Hi there.
Hello.
Who do we have here?
Here's Monkey. He has a little bit of pain in his stomach, I've noticed. He just seems not like himself, a little bit lethargic. But he hasn't been going to the washroom either. He just doesn't seem like he's too happy. His stomach seems... He just hasn't been eating as well.
Okay, sure, we'll take him into the back and we'll give him a quick examination and see what's wrong.
So who do we have here?
This is Monkey. He weighs around 90 pounds. He's come in with a lot of abdominal pain, and he hasn't been able to have any successful bowel movements.
Very fidgety.
Yeah.
That's too bad. Are his vaccines up to date?
Yes, they are.
Have you changed his diet recently at all?
No, it's the same diet.
Okay. Let's just give him a quick little look. Oh, look at you. Let me see your big pearly whites. Oh, you're a drooler. Okay. That's okay. 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 I need you to sit up for me. Come on. Ooh. Okay, he's a little bit bloated. A little bit tender. Does he like to eat things, like random little things?
Yeah, I've seen him eat like other garbage and stuff.
Sit right down there, bud. So it seems like he may have eaten something he wasn't supposed to, and it got stuck up in there.
Oh, okay.
Alright. After giving Monkey his physical exam, we brought him into the x-ray room to do an abdominal x-ray to confirm our suspicions if it's a foreign object and to see the severity and the size and shape of possible foreign objects.
Alright, what do we have here?
This is Monkey. He needs to have an abdominal x-ray because we feel like he has something in his intestine.
Alright, perfect. So we're just going to position him underneath it. Perfect. Do get the x-ray done. So, yeah, that should be a good position. Alright, let's get him up first. So we got our lead gowns on, our lead glasses. Dr. Huckstep was telling me that Monkey's a pretty good boy, so all we're just going to do is tie down his limbs so he just won't be moving during the exam, but he's not sedated, he should be fine. Tie it down. Boom. Just going to hold his head for me and I'll go start the x-ray.
Okay.
Beep, 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 boop. Alright, that should be good. That's on time, we go. Alright, so after performing our x-ray, we noticed that we found a very large object within his, as we noticed, his intestines. We noticed huge gas pockets blocking the intestines, as we would assume. So it actually isn't in the stomach, it's more in the intestines. We'll most likely have to perform a surgery at the intestines, making a small incision here and pulling the intestines out and locating the object and removing it. But besides that, he should be pretty good. We're just going to get to surgery now. Alright, so I'm going to be prepping Monkey for his anesthetic. We're going to get him under so he can be sedated while we do the surgery. So first I'm going to give him a shot of ketamine to get him sedated. So I'm just going to inject here. We already have a catheter in, so I'm just injecting the ketamine into that slowly. It's injected now. Let it run its course for a second. Then we're going to hook him up to our anesthetic machine, which is this. So I'm just going to place, the tube's already down his throat, I'm just going to place this on the end, boom, in his mouth, tape it shut, get it on, flow meter's up, it's working, no leaks, everything's good, and now we're just going to clean him up and get him ready for surgery.
So first, before Monkey's surgery, we have to disinfect all surfaces. So I'm just going to disinfect the table. And next I'm going to put a heating box that I've been in the microwave to keep Monkey warm during surgery. And then I'm going to cover it with a warm blanket so Monkey is comfortable, and also to cover the table. And now I'm going to open the sterilized pack so that the surgeon has all his tools ready. And there we go. All's prepped. So now that Monkey is under anesthesia, we're ready to prep him for surgery. It is crucial for him to be sterilized so that the incision does not get infected. So first of all, we're going to use a size 40 blade to clip away Monkey's hair. You want to make sure you get all the abdominal area clipped and leave a clipper length, like width, space on the outside so the surgeon has extra room. And once you've done that, you have to vacuum all the hairs so they don't get into the incision. Now that is completed, first of all we use soap to clean the area, and you want to use it in a spiral pattern that's away from the incision. And you want to repeat this as many times as necessary. The second thing you use is alcohol, and that just takes away the extra skin oils and soap that is left behind. And then finally use iodine, which is the disinfectant. And now Monkey's ready.
Alright, so we're prepping for surgery here, so we're just going to wash our hands, get up to the elbows, get it all cleaned up and disinfected before we gown up for our procedure. So we're just going to have Jesse here wash his hands, and I'm going to follow behind after. We're going to make sure not to touch anything with our hands, seeing as they're already clean, before we put any gowns on or anything. We should be good.
So we've got the gown out of the autoclave. So I'm just going to gown up, put the gloves on, we'll be all good. Gowned up and up. Done.
Alright, so we're all ready for our surgery. We still got them hooked up on our anesthesia. We got them hooked up to IV fluids. We got our tools here. We got our Olsen Haggers, our drape clamps, our syringes, scalpel, our 2 clamps if needed, and then we got our gauze and our towel and our gauze, sorry. And we're going to move over to Jesse to do the performance surgery.
First of all, we're going to make our original incision, so scalpel. Thank you. Okay. Make our incision. Okay. Put that there for now. And we have to try to find the intestines. Oh, here we go. Oh. Okay, just slowly pull these out. You can see that they're darker, seem slightly inflamed the closer we get to the foreign object. And as you can see right here, we have it. Okay, you can see all around it, it's a much darker red. Okay, so scalpel again, please. All right. Actually, first, I need to clamp off either side to make sure the contents of the intestines don't spill out. One side and the other. Okay. Then we make our incision. And boom. Yo, a chess piece. Checkmate. Okay, so I need to suture it. Pass me the needle holder, please. Thank you. We suture it up. Close it off, and the syringe, we're going to fill it up with silicone to make sure that there's no holes in the suture. Alright, there we go. Seems like we're good. So we will take these off, and we can put this back in. And need the needle holder again, please. Oh, okay. And suture this back up. Okay. And there we go.
So now that the surgery tools have been cleaned, we're going to place them in a pack and properly wrap them, and then they'll be placed in the autoclave for them to be completely sterilized. So first of all, we're going to place the loose instruments in an imaginary rectangle. And then after that, we're going to place gauze on top. And following that, you have your indicator. And then after that, you'll have your ringed instruments. And you just want to place them as best you can. And then following that, you'll have your surgical drape. So now it's in a nice little square. And next I'm going to use a style called gift wrapping. And you want to make sure it's as tight as you possibly can have it. So you fold the two ends in and fold them in, and then you fold these two into half and pull it over, and then the next two. And then voila! So after Monkey's gastric hysterectomy, we are now having him in hospital for around 2 to 3 days on IV fluids. We'll also be checking his vitals every 2 to 4 hours. When we send him home, we recommend that for your incision care that you make sure you check it twice a day for oozing, extra swelling, and bleeding. A little bit of redness and swelling is normal when it comes to surgery. We're also sending Monkey home with antibiotics and anti-inflammatories. Activity level should be kept to a minimum for the next 10 to 14 days until his sutures get removed. We also recommend that he wears the e-collar for that amount of time. Also for the diet, we recommend that he has ID, and then he should be good to go. Okay, so now I have to disinfect all surfaces getting ready for Monkey surgery. So first I'm going to disinfect the table. Oh fuck, you know what we need?
Let's see. Now we're recording.
You're recording?
Yeah, I'm recording. Hello. That's gonna be on the blooper reel!
What?
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 Shut up. Oh, I've stopped recording. It's not stopping. You're fucking back up. Okay. Come on.
Okay.
That wasn't that bad. I feel like #strongman.
Did you like grab right there?
Yeah.
You're not supposed to like, you know, that's